So I guess there's a couple of ways to take care of gum disease.
Yes.
The traditional way and using a laser. Tell me about that.
Gum disease is the #1 cause of tooth loss in America for adults. So it's a very, very, very serious problem. Traditionally, the way it was addressed is the gums would be opened, the bone would be cleaned, the teeth would be cleaned, and the gums would be stitched back in a lower position on the tooth. So the tooth would look longer, there'd be black triangles between the teeth, and now the patient would have sensitivity on the teeth. What we do is a little bit different.
So you kind of cut out the infection in a way.
It would be like going to the doctor and saying, "Doc, I have an infection on my finger," and your doctor's answer would be, "Oh, no problem. We're just going to cut the end of your finger off and your problem will be solved." That doesn't make a lot of sense.
All right, all right.
So what we do is, and I became so passionate about this procedure, I ended up, and I was personally invited by the inventors of this procedure to become an instructor for it. That's how passionate I am about it.
So this is an FDA-approved laser?
It is. It is. The procedure is called LANAP, and what it involves is taking a laser, passing it between the gum and the tooth, cleaning out the diseased tissue, cleaning out the infection, and what is left behind is good, healthy gum.
So the laser what? Kills the bacteria?
Kills the bacteria, removes the diseased tissue, we clean the teeth, and now we have an environment where we'll get a little bit of bone growth, we'll get some bone growing back, which is great, without having to use any bone powder or anything along those lines. And the best part, though, for the patient is, #1, they don't have the longer roots that can then get cavities and so on. They don't have the sensitivity because those roots are exposed. And they don't have the black triangles between the teeth. And the best part, and this is my favorite part out of all, is when we talk to them the next day, they wonder if we even did anything because they don't have any discomfort afterwards.
That's very nice. Now, you're the gum specialist as a periodontist,
Yes.
right? Because not all periodontists believe in this lasers. I was talking to a periodontist, he said there's no proof that it works.
Well, I think
so it does work.
They need to come to Rochester, New York, where they can see the thousands and thousands of patients I've treated and just ask them. It's absolutely amazing how many people have benefited from this. People that think they're going to lose all their teeth. I get referred patients that think they're going to lose all their teeth. Their dentist has told them, you're going to lose all their teeth. 10 years later, guess where those teeth are?
They're still there.
They're still there.
So how? I don't get it.
Randy, when I teach the course, it's 3 days long. But so I'm going to condense it a little bit for you.
It's simple.
It's a bacterial infection. The laser is helping us get rid of that infection. The gums get tighter. The bone regenerates.
So they grab onto the tooth?
And we also balance out the bite a little bit.
Okay.
So that we're able to bite a little bit in a more healthy way. And the next thing you know, we've got healthy gums and a happy patient.
People that were told the teeth had to be taken out.
I think they are as happy as denture wearers that get implants.